Hey mama, if you've been dealing with sharp shooting pain down your butt and your leg in pregnancy, especially when walking, sitting up, or rolling over in bed, or maybe even just getting up off of the couch, what you're feeling may actually be sciatica. And if you've been Googling how to relieve sciatica during pregnancy, then you've probably seen a lot of stretching recommendations. But here's the thing, stretching alone can make a lot of women have worse pain. The good news is that you are not alone. There are actually specific exercises that you can do to safely reduce sciatic pain in pregnancy by improving alignment, stability, and deep core support. In today's video, I'm going to walk you through 5 pelvic floor PT designed exercises to help you relieve pregnancy sciatica pain, not just temporarily stretching the pain away. Hi, I'm Dr. Towne, pelvic floor physical therapist, pre and postnatal exercise specialist, and mom of almost 4. And today I will show you why sciatica actually happens in pregnancy, why it often feels like it comes out of nowhere, and what actually helps your body feel more supported. But before we jump in, if you're looking for more pregnancy safe workouts, make sure you like and subscribe. My goal is to help you feel strong, supported, and confident throughout all of pregnancy and postpartum recovery. All right, mama, let's get into it. First, let's talk about what's actually going on, because understanding the why behind your pain matters. Sciatica happens when your sciatic nerve becomes irritated or compressed. Your sciatic nerve runs from your back all the way down through your glutes and then all the way down the back of your leg. During pregnancy, several things can contribute to irritation with this nerve. Your growing belly shifts your center of gravity forward, so then your posture changes, your core becomes less supportive, and the pregnancy hormone relaxin makes your joints and ligaments more mobile. And while increased mobility is normal during pregnancy, too much mobility without muscular support can cause instability around the pelvis and back. That is why so many women experience pain, numbness, tingling, burning, or radiating pain down the leg. And honestly, a lot of women tell me their pain came out of nowhere because it just happened when they were bending down or rotating over. But usually it's not random. It is your body's way of telling you that you need more support and more stability. This is why I don't recommend aggressive stretching for pregnancy sciatica. Most pregnant women actually need better deep core stability, stronger glutes, improved pelvic activation, and better alignment. And if you've been afraid to move because everything feels irritated right now, I want you to know that gentle, intentional movement is one of the best things you can do. And that is exactly what these exercises are going to focus on. Quick note, if your pain is severe, causing significant weakness, affecting your ability to walk, or radiating heavily down your leg and into your foot, make sure to check in with your doctor. These exercises are best for mild to moderate pregnancy sciatica symptoms. As we go through these exercises, I want you to stay connected to your body. Stop or modify if you notice any of the following: sharp or worsening pain, numbness increasing, pelvic pressure or heaviness, pain radiating further down the leg, leaking, or anything that just doesn't feel right. We always want to work with your body, not against it. Remember that a small range of motion still counts. Slow and controlled is exactly what we want here. These exercises tend to work best when paired with a pelvic stability band or pregnancy support shorts or leggings. I linked a few of my favorites in the caption below. All right, mamas, let's get into my 5 favorite pregnancy sciatica relief exercises. grab a small ball or a pillow and lay on your right side with your knees and hips at 90 degrees and the ball in between your knees, and then your head just comfortably resting on your hand or on your shoulder, whatever is more comfortable. Then you're going to inhale through your nose. As you exhale, you're going to pull the ball back with your left thigh using your inner thigh, and then you're going to push down on the ball. Again, squeezing the ball gently so you get some inner thigh engagement. We're going to repeat that a couple times here. So inhale through your nose, pull that left hip back, and then exhale through your mouth. Gently squeeze in on that ball. Each time we're going to try and pull back a little bit further. So inhale, pull back. Exhale, push down. Once you feel like you can't pull back any further, then go ahead and reset and start it again. If you're feeling any pinching in the front of the left hip, then do a little bit more of a posterior pelvic tilt or tucking that pelvis underneath you. Let's do that again. So inhale through your nose, pulling left hip back. Exhale. Gentle pressure on that ball. Inhale, pull back. Finding length in the outer glute on the left. Exhale. Squeeze in. One more here. You got it. Inhale, pull back. We're trying to lengthen that back hip gently without aggravating that tissue. Exhale. And push down. And then slowly return. Now grab a ball or a pillow and put it in between your knees. You're going to put your knees right underneath your hips and your hands right underneath your shoulders. You're going to take a big inhale through your nose. As you inhale, I want you to breathe into your shoulder blades as much as you can, expanding that back and side rib cage, and then exhale through your mouth. As you exhale through your mouth, I want you to think about pulling your hip bones together and giving that baby a gentle squeeze or hug. So inhale through your nose, breathing into that upper back. Exhale through your mouth, lifting that belly up towards your spine and pulling those hip bones together. Inhale through your nose. Exhale through your mouth. You're in a gentle rounded position here. The key is we don't want to be coming in and out of that position. We want to be keeping a little bit of a posterior pelvic tilt. So we're really engaging that deep core. Inhale through your nose. Exhale through your mouth. This should be relieving some of that low back tension and improving our pelvic and core stability. Last one here. Inhale through your nose. Exhale through your mouth. Good deep core engagement, feeling that transversus abdominis engage. For this exercise, go ahead and sit tall in a chair with your rib cage stacked over your pelvis and put a ball or pillow in between your knees. You're going to inhale through your nose, breathing into your rib cage, and then as you exhale, you're going to gently squeeze that ball together. Hold for a couple seconds, feeling your inner thighs engage, and then slowly relax. So inhale through your nose, 360-degree expansion. Exhale through your mouth. Gentle squeeze of that ball, feeling those inner thighs engage, feeling a gentle squeeze or hug of that baby as well. Let's do a couple more just like that. Inhale through your nose. Exhale through your mouth. Just a gentle squeeze. We're not trying to pop the ball or anything here. We just want gentle engagement of those inner thighs. Inner thighs really help us with pelvic stability, which is incredibly important throughout pregnancy in order to prevent that sciatic pain. Inhale. Make sure you let go of that ball or let go of that pillow tension, and then exhale. Gentle squeeze. If you want to do a little more pressure or a little less pressure, you can. You choose your level of intensity here. Last one here, exhale. Contracting that deep core as we engage those inner thighs, focusing on that pelvic stability. Then relax on inhale. We're going to stay in a seated position, but this time we're going to grab a resistance band and put it around your feet up towards your knees here. And we're going to focus on our glute strength because glute strength is incredibly important for sciatic pain prevention. So make sure you're sitting up nice and tall, rib cage stacked over pelvis. Inhale through your nose. As you exhale, I want you to keep your feet down, but push your knees out against the band. Hold there for a couple seconds. You should feel both outer hips burning, and then slowly come back in. Inhale. Again, through your nose. Exhale through your mouth. Try and keep your feet down as you push those knees out against the resistance band. And you choose how hard that resistance band is. If you have more tension, it's going to be more challenging to push out against that band. If you do not have a resistance band, then you can actually use your hands instead and put pressure into those knees with your hands and your upper body. Make sure you're focusing on good form, sitting up nice and tall here, keeping core engaged. Couple more here, feeling that burn. Make sure you're pushing both knees out into the band equally. We don't want to be pushing more with one side versus the other one here. Last one here. Feeling that burn again in those outer thighs, really focusing on pelvis stability coming from those side glutes. Then slowly come back in and relax. We're going to finish by sitting in a chair and doing sciatic nerve flossing. This is different than stretching. Nerves do not like to be stretched, but they do like to be flossed or coming in and out of a nice glide. So make sure you're sitting in good posture. Go ahead and straighten your right leg out on the ground and then slowly bring it up off of the floor and bring your toes up towards you. If you start to feel pain in your low back, then don't lift up quite so high. Hold there and then bring it back down. So you'll point your toe to come out of the stretch or out of the floss, and then you'll flex your foot to again floss it again, and then lift up as high as you can without feeling pain. This is not a stretch where you want to feel a lot of pain. Nerves get very easily irritated, so we want to be gentle with them. So when you bring your leg up, if you're not feeling much of a stretch, then you can gently lean forward into it and gently bring your chin down towards your chest. But if that is too intense, then make it a little bit more gentle here. To completely come out of the stretch, just bend the knee. Then again, straighten the leg, toes up towards you. Lift the leg to a spot where you feel a stretch, but it's not too intense. And then slowly come back down. Again, if you want to make that stretch more intense, then round forward and bring your chin down towards your chest. That will intensify that gliding position. If your pain intensifies during and or after this, then you know you push that nerve gliding a little too much. So just back off the dial of intensity just slightly. We also want to make sure that we're not holding this for a super long period of time. Just a couple seconds in that flossing position is perfect. No longer than that. And those are your 5 exercises for relieving sciatica during pregnancy. Safe, supportive, and designed to help your body feel more stable instead of just temporarily relieving the symptoms with stretches. One thing I really want you to remember is that consistency matters more than intensity right now. Just a few minutes of intentional pelvic floor and core stability exercises can make a huge difference in how you're feeling. And if you're looking for more support like this, that's exactly why I created the Strong Expecting Mama program. It's a pelvic floor PT designed program to guide you through safe exercises through all of pregnancy. It helps reduce pregnancy pain, it helps prepare your body for labor, and it helps you prepare for postpartum recovery before you're even there. You can click the link below to start your free 3-day trial to see if it's a good fit for you. And if this video helped you, make sure to like and subscribe for more pregnancy-safe pelvic floor PT guidance, and send this to a mama who's experiencing pregnancy sciatica right now because she deserves support too. I'll see you next time.